Hello, friends. Today's topic is love your stomach and avoid its problems. There is a very good saying, you can't live a full life on an empty stomach. So, I am Dr. Jagajit Singh Virk, MBBS, FCGP, FAMS, PGDGM. This is the picture of stomach with the intestines, rather the entire gastrointestinal system. Structure of stomach. Depending upon the position of your body and the amount of food inside it, your stomach is capable of alterations in size and shape. Your empty stomach is about 12 inches long and at its widest point, it is about 6 inches across. Here is the inlet of esophagus. This is the whole stomach. This is called fundus. This is the body. This is the greater curvature. This is the lesser curvatures. This is the insula angularis. This is pylorus, this part. This is the antrum. This is the pyloric sphincter joining with the duodenum as a C-shaped first part of small intestine. Where the hydrochloric acid secreted. Parietal cells within the stomach lining secrete hydrochloric acid that lowers the pH of the stomach. A low pH 1.5 to 2 activates pepsin. Acetylcholine, gastrin, and histamine stimulate the proton pump in parietal cells to release hydrogen ions and decrease pH. What are the three functions of hydrochloric acid in the stomach? Chief function of hydrochloric acid is to maintain low pH to destroy growth of microorganisms, to facilitate absorption of proteins and minerals, to maintain low pH, to activate pepsinogen to form pepsin, which digests proteins, to dissolve enzymes secreted in stomach. Hydrochloric acid is an essential acid in the stomach, enhancing the absorption of minerals and breaking down the connective tissue in the meat. What causes low HCl? Eating under stress. When you are under stress, you can't have rest and digest. Eating a nutritionally deficient diet of processed and fast foods. Lack of sufficient minerals in the daily life diet. Excess carbohydrate consumption and poor food combining. Zinc deficiency. B vitamin deficiency, especially thiamine deficiency. Refined sugar, which depletes minerals, replace mineral depleting refined sugar and sweeteners with maple syrup, honey, or stevia. Chronic illnesses, drinking ice water with meals. Age, as you get older, stomach production tends to decrease, especially if there is any chronic illness along with. Antacid use, taking prescription and over-the-counter drugs that suppress hydrochloric acid production either directly or indirectly, candida infections. All these are the causes of low HCl. How do you stimulate HCl production? Ways to naturally increase HCl production. Relax at meal times. Wake up your digestion with one or more of the following. Add fermented veggies to your diet. Eat real food. Don't forget the salt. Increase zinc intake. Choose a whole food multivitamin. Use food combining techniques for proper digestion. How do I know if I have a bacterial infection in my stomach? Symptoms may include nausea, vomiting, fever, abdominal cramping and pain, diarrhea, possibly bloody, dehydration, and electrolyte imbalance. What are the diseases of stomach and duodenum? Diseases of the stomach and duodenum include gastritis. Gastritis is when the stomach lining becomes inflamed or swollen. Gastroenteritis is an inflammation of both the stomach and small bowel. Gastroparesis, when these movements are restricted. Non-ulcer dyspepsia, peptic ulcers, stomach or gastric cancer. What's gas? Gas is a normal part of healthy digestion. Air that is in your digestive tract is either released through your mouth as a burp or through your anus as gas. You typically pass gas 13 to 21 times a day, average 17 times a day. How gas is formed and treated? It is your ingested gas, air, aerophagy, certain foods that form with fermentation, lactase supplements, we can give alpha galactosidase, an enzyme we can give simethicone, and probiotics to treat. Which foods cause gas? You have probably noticed you feel gassy after eating certain foods. Cut back on the common culprits. Apples, asparagus, beans, broccoli, Brussels sprouts, cabbage, cauliflower, milk and dairy products, mushrooms, onions, peaches, pears, prunes, and wheat. How do you fix stomach problems? Diet and lifestyle changes can make a big difference. Cut back on fatty foods, avoid fizzy drinks, eat and drink slowly, quit smoking, don't chew gum, exercise more, avoid foods that cause gas, avoid sweeteners that cause gas such as fructose and sorbitol. What is heartburn? Heartburn, sometimes called acid indigestion, is a painful burning feeling in the middle of your chest or the upper part of your stomach. The pain, which can also spread to your neck, jaw, or nerves, can last just a few minutes or stick with you for hours. What causes and triggers heartburn? Lower esophageal sphincters, laxity of that sphincter, overeating, when you eat spicy, fatty, acidic, or greasy foods, when you consume caffeine or alcohol, smoking, when you lie down shortly after you eat, you are under stress, you are overweight, you are pregnant, You have a hiatal hernia where the stomach bulges up into the chest through an opening in the diaphragm. Triggering foods are alcohol, chocolate, coffee, fatty or fried foods, greasy foods, onions, oranges, lemons, and other citrus fruits and juices, vinegar, hot sauces, salad dressings, peppermint, sodas, and other bubbly things, spicy foods, tomatoes, and tomato sauce. When is heartburn an emergency? If it hurts to swallow, you feel like you are choking, you have black tarry looking bowel movements, your mouth or throat hurt when you eat, you have difficulty swallowing foods, your voice is hoarse, your vomit contains blood or what looks like coffee grounds, you have trouble breathing. What's GERD? Everyone has a heartburn from time to time, but when you have it frequently, at least twice a week, for a few weeks, or when it begins to interfere with your daily life or damage your esophagus, a long-term condition called gastroesophageal reflux disease or GERD. It's also known as acid reflux disease. Heartburn is the most common symptom of GERD. What are other symptoms of GERD? Bad breath or a sour taste in your mouth or in the back of your throat due to regurgitation of acid, certain breathing problems, cough, feeling like you have a lump in the back of your throat, hoarse or raspy voice, nausea, difficult or painful swelling, sore throat, tooth decay, and vomiting. What are the complications? Certain breathing problems like asthma, nighttime choking, and repeated pneumonia, changes in the cells that line the esophagus called Barrett's esophagus. This can possibly lead to cancer of the esophagus at the lower end, mainly. Painful inflammation of the esophagus called esophagitis, narrowing of the esophagus called an esophageal stricture. This can cause problems of swallowing. What's the treatment of GERD? Your doctor may prescribe one or more medicines to treat GERD. Antacids. Doctors may recommend antacids to relieve mild heartburn and other mild gastroesophageal reflux and gastroesophageal reflux disease symptoms. H2 blockers, proton pump inhibitors, other medicines, fundoplication, bariatric surgery, endoscopy. How do I stop constant stomach pain? Some of the most popular home remedies for an upset stomach and digestion include drinking water, avoiding lying down, ginger, mint, taking a warm bath or using a heating bag, bread diet, avoiding smoking and drinking alcohol, avoiding difficult to digest foods. How can I clean out my stomach? 7 ways to do a natural colon cleanse at home. Hydration, drinking plenty of water and staying hydrated is a great way to regulate digestion. Salt water flush, you can also try a salt water flush. High fiber diet, juices and smoothies intake. You can have juice fast, more resistant starches, probiotics, and herbal teas. What is a hiatus hernia? A hiatus hernia is when part of your stomach moves up into your chest. It is very common if you are over 50. It doesn't normally need treatment if it's not causing you some problems. What's the main cause of hiatal hernia? The most common cause of a hiatal hernia is an increase in pressure in the abdominal cavity. Your abdominal cavity is the space in the middle of your body that holds several organs, including the lower part of the esophagus and stomach, small intestine, colon, and rectum. What are the warning signs of hiatal hernia? Signs and symptoms of a hernia: an obvious swelling beneath the skin of the abdomen or the groin, a heavy feeling in the abdomen that sometimes comes with constipation or blood in the stool, discomfort in the abdomen or groin when lifting or bending over, a burning or aching sensation at the bulge. That's all. Thank you very much.